Hi, guys, and welcome to today's Facebook Live. Hi, Rebecca. Thank you for joining us.
Hi.
Hi. Awesome, guys. So if you're joining us live, it's really great to have you. Rebecca and I are going to be chatting about using Kinesiotape in lymphatic dysfunctions or lymphatic conditions in horses. So any questions that you have, please share them, join in the conversation, comments, thoughts, experiences, share those with us as well. So Rebecca, will you please introduce yourself, tell us a little bit about yourself and why you use Kinesiotape in lymphatic dysfunctions or conditions in horses?
Sure. Well, it's exciting to be here as always with you, Anne. I just love our conversations. My name is Rebecca Haddock. I'm the owner of Equitape, and this is my life in my field. Everything kinesiology tape out there. Equines only, though. That's my kind of my world. So really, what started in using kinesiology tape in lymphatics is a really cool case that Dr. Beverly Gordon did years and years back on a lymphagititis case, and just showing the effects of how kinesiology tape, because it is decompressive in nature and it recoils and it basically creates like a pump. And so it was so effective in the particular case that she started using it on that it just kind of took her and then myself into a dive on what else can we do, lymphatic speaking, how else can we affect the horse positively, obviously. And one of the great things about kinesiology tape that I love is there are very few contraindications of when to use it. And we've never had a report on a negative outcome. So there are no negative side effects when using kinesiology tape. So it is a modality that you can really dig into and start to see and feel how effective you can be in sometimes cases that are traditional medicine leaves us lacking. And so we have done quite a few massive case studies over the years, and I did bring you a few of them so you all can see it yourself. But we've done some pretty massive case studies over the years, and I'm just constantly amazed. I had a customer the other day. We had to sub a roll of tape for her, one color for the other, and we called her and we said, hey, is blue okay instead of black? Or I don't know what color it was. And she said, the tape is magic. I don't care what color it is. And that's how I think a lot of us feel is, this is like magic tape. But there's good science behind it. So that's one of the things that we can discuss today.
Awesome. Thank you. So those that have jumped on live with us, it's really great to have you. Thank you for joining us. Please feel free to ask any questions, join the conversation, let us know where you guys are. If you want to ask questions about a specific case that you have, feel free to do that. Let's just discuss and have a conversation. So, Rebecca, what are some of the causes of lymphatic damage or dysfunction in horses?
Well, the lymphatic system is pretty unique in the sense that whereas your heart pumps the blood through your body, and the lymphatic system doesn't have that. So what we see that happens, so let's just talk about like lymphagititis or cellulitis. It's basically the same thing. We have three different names for it, vasculitis, whatever. You can call it the same thing. It's all funnels into the same principle of the lymph nodes that live within the skin or the connective tissue. For some reason, they become inflamed and then infected. And we're always trying to figure out why and how this happens. Could it be a puncture or maybe just a scratch that allowed bacteria in, whatever. But the way the fluid moves is highly dependent upon the movement of the horse itself. So most of the times lymphatic issues are that. And the lymph system is filtering the fluid through and it's cleaning it. It's cleaning the bacteria out. It's cleaning the intruders out. So the lymph system, lymphatic fluid itself is very important for any animal, human, of course. So in the process of that happening, if you get, as the fluid is moving through, it's almost like a valve that will shut off and the fluid starts to build, right? So what we're looking for in these is why and what causes it to do that. Lymph basins, you have quite a few lymph basins in the horse. And so understanding where those are, you can see, swelling in the lymph under the head and neck areas or in the shoulder. That's another big lymph basin. That usually tells you that something is blocking that valve, if you will, from being able to allow the fluid to go through. So generally it's either some type of block, something like that, which could be from injury or a virus or something like that. And then, it's not rare, but it's not super common either, is when, you do get the lymphagititis, the cellulitis, things like that. And that's where not only have you become inflamed, but now infected, and it usually happens in the legs, and most of the time it's the hind legs. And then in our very unfortunate cases where it becomes chronic lymphedema, so it's no longer infected, there's no systemic infection going anymore, but it's chronic lymph fluid and fluid stasis just sitting in the legs. All right, so these are your basic lymphatic issues. And so, yeah, I think that pretty much answers that question.
All right, perfect. So let's discuss some cases. You've prepared some cases for us here, and I think that's really great. We've had even more people jump online with us, so welcome everyone. It's really great to have you. We're talking about lymph issues in horses and how we can use Kinesiotape to work with that and help treat that. So Rebecca, what are we looking at with this guy, and what did you do with it?
Sure. So this is a 16-year-old off-the-track thoroughbred mare. She came out of the pasture one day and her leg was swollen up. She was running 105 temperature, 3-legged lame, those instances of lymphagititis. And so her owner did all the vet stuff. And, I would highly recommend, quickly, let me just tell you the 3 contraindications of when not to use kinesiology tape. First is if your animal has any type of systemic infection. Okay, so this is inside of the body. It can be whatever's causing it. We don't use kinesiology tape until the animal has been on antibiotics for at least 4 to 5 days. Okay. The first thing that kinesiology tape does is increase circulation. The last thing we want to do is circulate an infection around the body. All right, so that's contraindication number 1. Number 2 is over an open wound. We always want to make sure there's a non-adhesive, like a Teflon side of pad in between the wound and the tape. And then last but not least is any kind of bacteria or fungus on the skin. It won't spread the bacteria or fungus, but it will not stick to it. So don't waste your money on using the tape then. Clear up the fungus or bacteria and then go ahead and tape. So now that the contraindications are out of the way, the owner did the traditional vet stuff, antibiotics, all kinds of different things, infusions. I mean, they did everything. Spent thousands and thousands of dollars on this. This is when she reached out for help with kinesiology tape. And so this was the start of where she was at. And so at this point, it had progressed to lymphedema, obviously. And you can see how severe it was and nasty it was. So the first thing that I suggest for people to do in these type of scenarios is to start activating the lymphatic system in the leg. So here you can see a little bit of what I'm talking about. And so those purple pieces on the side, that is communicating with the lymph basins. And so on the other side is the worst leg, but it's the same thing on the other side. So we're communicating with the lymph basin. Every step that the horse takes, it will create a pump action. And so we start to help pump the fluid. So we're in a way creating an exterior pumping system to move the lymphatic fluid away and into the basins and then to be moved off, right? Back to what it's supposed to do. So with these type of extreme lymphedema or chronic lymphedema, any time past the active infection, you want to start doing these type of applications, circulation applications, moving fluid away. And a lot of vets will do standing wraps. It doesn't work very well. It also interferes with the animal's ability to move. We need them to move. The more they move, the better they're going to get faster. So, I did a little bit outside of the box, and obviously she had to make her own decisions on what she would do, but I very much encouraged turnout and as much movement as possible. And so she did that as well. And then she ended up, she was making great strides in all honesty, but she came here to the Equitape facility so I could do a little bit of R&D myself. And since she's been here, I've done a lot of work in the back, in the hind end, sacroiliac pelvis, trying to unlock the whole lymph system as it moves through the body to see if there's any blockages. We also did fascia work. So this is lymph support of the tendons, the fetlock joint, to protect it during this time period, and fascia work at the same time, which helps a lot. And obviously that piece around the coronary band, that's really important in helping these horses. So we did that. And then I started moving into higher in the body. So here is one of the applications I did. It's still a lymphatic application, but it's also giving decompression to certain areas so I can start to, again, I want to open that valve up, right? So we did that with her. I put her on quite a few different herbs. She's on a blend of about, I think it's somewhere around 52 different herbs to also help cleanse her body and her systems, increase circulation, help her fight off toxins or allergies or anything like that, right? So you go out into nature, and if you see a horse, a wild herd, you will see them eat flowers or leaves or bark, and they're constantly picking what it is they need their body to do. And so it's that kind of principles. We did some herbal things with her as well. I made sure she had the right amount of minerals, and really just kind of address the whole horse. But so I would highly suggest anybody in these type of scenarios do that as well. So deal with the whole horse. So this, and you can see from that first group of pictures how the lymphedema had recessed all the way down into just in here at this point in time. So she was doing quite a bit better. You can see how we're activating the basins again with a lot of decompression. And those strips running down the leg, that's a channel. We're creating a channel for things to move. And then lower leg, I used a very big circulation application. Instead of cutting tentacles, I did 2-inch strips the whole way, because I also used those to support the fetlock and the hop going up. I wanted to make sure that we support the biomechanics underneath that sitting fluid. I think that's very important. Sometimes we forget about that, and then we get it all out and our horse is kind of jacked up underneath. And this was her leg, and you can see now, you can actually see the fetlock and the cannon bone. And this was, I took this picture of her, I think, what is today's date, the 10th, 11 days ago. So
All right.
quite a bit of progression. She runs around and plays. She's gone back to work. She gives lessons to young kids, and yeah, she's going to live a pretty normal life. And this is her normal. I hadn't taped her for over a month when I put this on, and I only did this for our Practical Solutions series. So it went on and I took it back off because she's staying like this naturally now. This is the worst she gets, which is massive for her. And so this is when I say it seems magical, it is because when you get these type of results, and what we're looking for is long-term results. We don't want these horses to have to live in tape. Now, can they? Absolutely. Will it hurt them? Not at all. Are there any negative side effects? None. Is it going to mess with their proprioception? No. Is it going to mess with the electrical systems in their body? No. It won't cause any negative outcomes. So she could wear this all the time, but the goal is to get her naturally down to where her body's not holding on to it. So she will do one more round of therapy, and this is a personal thing that I've done with her once. I talked to an incredible rehab specialist, and we decided to mix a steroid with a DMSO poultice. And so just cover the leg in that. And she had a really great reaction and held. So I'm doing one more therapy to see if I can pull even more out and get her to where the average person wouldn't even notice the inflammation left. And then she goes home in about 20 days. So just a lot of different things that you can do to help these type of cases. But by and large, the most effective in getting her to the point that I could address the other issues has been the use of kinesiology tape on her.
Awesome. I really like that, you've spoken about there are so many things to address. We need to address the fascia. We need to look at what's happening higher up, because somewhere there's a restriction that's causing that buildup of fluid, and it's about finding that and opening it up again. So I really like that. And you've also showed us quite a few different ways in which you've taped this leg. So that's also nice to see that it isn't just one way. You can change it up a little bit and play with it. And I love that as well. Guys, I'd love to invite you to ask any questions, to share your thoughts and comments. That's what we're here for. It's why we're live with you. We'd love to hear from you. So please share.
Yeah. Absolutely. Any question you have, just fire away. And it's a big case study, and it's been one that's been going on for, I believe, 1.5 years now is when she initially contacted us. So a lot of work has gone into this horse to get her to the place where, I do believe this next round of treatment is because of how much of a reaction we had out of the first one. This next round is really going to knock her down. And, and by the way, doing this is quite a bit less expensive. So I should also point that out to your audience. The thousands of dollars that she spent on all of the things that they did, and she'll tell you herself, and I've got a live interview with her. It's in somewhere in our Facebook, but I'll repost it again. If your audience wants to stop by the Equitape page, I'll repost it again. It was just ineffective. Nothing was helping her. She was just getting worse. And so the amount of money that she has spent since going into the kinesiology taping protocol is, hundreds versus thousands. Mm-hmm. And so there are times, and, as we've talked, I say this a lot to you, so I'm sure you're getting used to it, Ann, but there are times that holistic is much better. And so these are areas that holistic is much better. She's living a normal life, running, playing, bucking, having fun. She's an absolute adorable mare. We call her the dragon because she's huge, 18 hands, and her head is like bigger than my body. But she's just as cute as a button and sweet as can be. So, giving a horse back their life is why we're here. We're here to change the equine industry. We're here to revolutionize horse care. And we've got to be willing to take on these very difficult cases to do it, but to show that consistently we are getting this horse better and better and better. So does she have bad days? Sure. When it's super hot and she doesn't want to move around, will she have a little more fluid stasis, a little more fluid buildup? Sure. Does she have great days when she's running around and playing and swimming in the ponds? And absolutely. And you can barely tell she has it. But the fact is her bad days are not stopping her movement anymore. It is not affecting her in a negative way anymore. So positive there. But yes, many ways to tape it. Again, we have to look at the whole horse and supporting these animals through the process and starting to move throughout the body and connect the different lymph basins together and open up. The joints need to be opened up. So the fetlock, the hock, the stifle, all the way into the SIs. This is important to keep those things moving. And when they get a lot of fluid buildup, and you see her first picture, she had all the way through the cycle. And when they get a lot of those joints don't move, if you've ever had swelling over your joint, it's very hard to make that joint move. We need those joints to move. The more they move, the more fluid they will push out of them. And so we need all the joints to move. And that's why, and you can see in the beginning, we also had her opposite leg taped for support. And so that she wouldn't cause damage in the opposite leg or the other leg. So now that she has no lameness and runs around and play, we don't need to do that anymore. But thinking about that, or the front, you can see in one of her pictures, I also had every leg was taped up. Again, as she leans forward, as they go forward on their forehand to try and take weight and pressure off of whatever hind leg is swollen up, that's more pressure they're putting on the forehand. So thinking about that as well. But I highly suggest doing fascia work in these cases. I think that it's incredibly effective as well. And just take your time and be patient is the biggest things I think. And so once it's all done, I will share with you her final picture before she leaves so you guys can see it. But that'll be, like I said, in about 20 days.
Awesome. That would be great. So guys, any questions or comments, please share them. It'd be great to hear from you. It's such an important thing to remember to keep the whole horse in mind, even when we're treating a specific pathology or condition. Like you said, the other legs are taking strain. We need to support them. The mechanics through the back are changing. The posture is changing. We need to support all of that. And when we think about bringing that horse back into full work, you have to reverse those changes again. So when there are changes within the neurological system will occur, changes within the recruitment patterns will happen as a result of an injury like this that takes a long time to heal. And we need to address those through the rehabilitation process. And Kinesiotape is a great way for us to do that. It's a great tool for us to add into that, into that toolbox. So I really love that.
I also want to point out on your long-term rehab cases, and this is based off of my experience and some of my colleagues in the field as well, and there is a psychological thing that also happens to these animals, and you need to be able to address that as well. They feel like they can't get away from danger. They might get more spooky or irritable. They may look at the human as, especially if they've gone through a lot of work before and it's not helped them, they're already associating you with something that doesn't help them. And so there is a psychological piece to it too. When she first came to the facility, she had to have a nanny horse. She was constantly whinnying and could not be left alone and would just freak out. Now she's out on 5.5 acres herself with her own pond. She's very comfortable. She grazes by herself. She plays. And then I will, she comes up to the fence. She's excited to see you. And so there was a lot of psychological that had to be dealt with as well. So your long-term cases, especially if you're just going to start using kinesiology tape on something that has been dealing with an injury for a long period of time, or something like this lymphedema, you are going to have to deal with that psychological part. And there's a lot of ways to help your horse do that. And if you don't know much about equine psychology, there are some great courses out there, great books out there. I would highly suggest digging in and educating yourself a little bit on equine psychology.
Perfect. Thank you. All right. And then you have another case to share with us that I'm excited about.
I do. I have another case I'd like to share with you. But first, I want to show you just some really fun examples of ways that you can use lymphatic applications to help horses deal with things like seasonal allergies.
Okay.
bug bites, especially like when they're out grazing and maybe they get into a bed of ants or something, they get all over their face, things like that. So here's one that we love to do, especially for seasonal allergies. You can also do this after teeth work or anything like that, after you're vaccinating, anything where you're causing the lymph system in through the head, neck, and jaw to have any kind of buildup and backup. This is highly effective, and the horses absolutely love it. Here's just kind of a purple and red application that was just because only one lymph node was seeming to be affected, so you can do it on one side, doesn't have to be on both. And then both of these side pictures are practical solutions that I teach in our in the practical solutions series. The star is done over the lymph basin in the shoulder, and this has helped Heaves horses, seasonal allergy horses. When you put that last piece of tape on, within 15 seconds, you're going to see a change in your horse. You'll see, especially if it's like fly season, there's lots of bug bites all over, you will see them just calm down instantly. It's one of the best applications I've ever used for things like that. And then the last one in the bottom right corner, this we use for bites on the face or runny eyes. And you can see that anchor is tagging back into the lymph basin there. So there are a lot of things that you can use lymphatic applications for in ways to make your horse's daily life better as well, without having to, my horses, I don't give them allergy stuff other than the basic herbal remedies that I can do. And that's because I have found that if I pump the lymphatic system, the body tends to help itself better than we can help it. So these are some fun things that you guys can do. And again, it's in the practical solutions if you want to learn how to do it. And then the last one is, those big Frisians, warm bloods, when they get that pocket of fluid on their sides by their shoulders right in here, this is a very effective application of moving that away. And so there's a lot of little things where you wouldn't necessarily think to use a lymphatic application, but they're so effective. And this guy, he works on trains all the time. He's an FAI dressage horse and beautiful. And his owner has to do this like once a month, and it just moves that fluid away and goes. So, all right. So those are the fun things I wanted to show you guys. The next case.
No, I love that. And it's so important to remember that, there are lymph nodes throughout the whole body, and it can, it's not always just the legs that are affected. It can be higher up, can be different regions, and we need to address those as well. So thanks for sharing those. Those are cool.
Anytime I see fluid pulling anywhere, there's a reason for it. There's a valve that's not opening, or there is a reason for it. It's like, oh yeah, sure, you could leave it alone and he'll be fine. Is it gonna hurt him over time? Probably not. But it is important, I think, to say, okay, well, it's a roll of tape. It only costs you about $20. I used maybe 8 to 12 inches of it. That's it. And it was gone within, I think, 3 hours. She called me. She's like, it's gone, both sides. I'm like, yay, So these are ways that we can actually help our horses who are not hurt, they're not injured, but make their lives just a little better. I have a buckskin. He gets bit by bugs all the time. He's like the most bug-bitten horse I've ever met in my life. I'm like, why do they love you so much? I fly spray him. I do everything. They'll go through the spray. They'll go through the fly sheet. I feel so bad for the guy. I put that lymphatic application on him, on his shoulder, and all of the bug bites, you can just see, they just decrease in size. He's not itchy, he's not scratchy, he's not upset. So these things, they do make a difference in our horses' lives. And when it's not that expensive and it's very easy and fast to do, you might as well do it and give your horse a little bit of relief. So yeah. All right. So the next case we're going to talk about is a pretty extensive one. And it does come with warnings. So first warning, and I'll have to have you do the thing that we did last time, because the video I want to play with you, we'll just have to pull it off my computer, because it obviously doesn't go over as a PDF when I put it in your system. But so first warning is that please don't attempt this type of application unless you are very good at taking equine vitals. So if you are a good kinesiologist and you've never seen something like this done, but you work right next to a vet or somebody who can do very good at taking vitals, especially listening to the lungs, and the more critical cases or the younger the horse is. Okay, so those are my warnings. You need to make sure that you are in your vital range. They can go to the high end of the vital range. You will see that happen for about 15, maybe even 20 minutes, but then they will come back down to the norm. If they go over the vital range, you need to start pulling a tentacle at a time off until you get them where they need to be. So that's my warning up front. All right, so let's talk about what happened. This mare was hit by a car. The vets were doing everything they could do for her, and her vitals were just plummeting. And they said there is nothing we could do at this point in time, but, ease the pain as she goes. So the practitioner this horse was worked on in Australia, Miss Kylie Abel, gave me a call in the middle of the night and asked for my help. And so the first thing that I had her do was to activate the entire lymphatic system of the horse. So that's what you're seeing, the yellow and the blue. So that is activating both the major front and hind basins, and we're connecting to all of them. So this is very extensive. Again, that's why it comes with the warning. So if you want to pull up I don't know how to do it. What do I do again? Just share my screen.
No, sorry, I changed the slide there. So I'm going to take this one down, and then you need to share again. So click the share button again, and then pull up that video. And then as soon as I see it from my side, that should be it.
You guys ready?
Ready.
So this was, she just did the application. The horse wouldn't move. She wouldn't put her head down. She wouldn't eat. She wouldn't drink. She would do nothing. And this was 40 minutes after the application was put on.
Beck, she is feeling amazing. She couldn't get her head down towards the ground before, and now she is asking for those little grass tidbits that we picked for her. She is amazing. We're just going to give her a nice big wet sloppy feed, high in some calories, and
So that was 45 minutes after. And you can take my screen share down now.
Here you go. Let me put this one back.
45 minutes after the initial application, her vitals did spike, which is exactly what we needed to do. So they went up into normal range. They did go up towards the high end of normal range, but that's good in a horse that system is shutting down. And then she leveled out within about 40 minutes. 45 minutes is when they took that video. She continued to do lymphatic applications on her over the course of that week, and everything past that was all addressing all the injuries from the car accident. And so this is her today, fully recovered. Lymphatic work can be miraculous. It can be miraculous if you know how to use it. And so I wanted to show it towards the end, because while we can do a lot of little things, and yes, we can help, really help a lot in chronic lymphedema and things like that, when you were talking about critical care cases, we had another critical care case, a 4-day-old baby foal was attacked by dogs. And we came in, we did the same type of application. We did have to remove tentacles on that baby because listening to the lungs, you could hear them start to wheeze. We pulled them off, and I mean, it happened within 15 seconds too. So when you're taking vitals, I'm having somebody take vitals every minute, then we go to 2 minutes, then we go to 5 minutes, and then we stay at 5 minutes till we hit that 40-45 minutes when things regulate out. So if it's too aggressive, you can pull a tentacle at a time off and get them right to that level that they're doing well with it. So I wanted to give you a whole range of different ways that you can help in different scenarios and different cases. And in these critical care cases, these type of applications can really just pull them out of, you know, where they're at. And it's really good at increasing the heart rate and temperature and just the whole system kind of waking up and activating. And then it is one of the biggest ways that the animals heal quickly, as well as having a good, strong, healthy lymphatic system that's moving everything and fighting off bacteria and all of the things that it does. So I know you have to have questions on that last round of stuff, so fire away.
We've got one right here. So amazing. So the tape is directing lymph flow from the direction of laying on tape, or just lifting the skin to give it room to flow, or both. So that's a great question. Talk to us a little bit about the mechanisms of action that we're assuming that the tape has here, and also the directional, how you're placing the tape and the direction of flow.
Yes, direction is very important. Okay, your anchor piece must be either on the lymph basin or going towards the lymph basin. And you can see some of the lines are kind of squiggly and others are straight. We're trying to follow the lymphatic system as best we can. Straighter channels are better because it is creating a channel for the fluid to go to. Everything that you're lifting with under that piece of tape is opening up, right? So we want to open up those blood vessels. Again, we're trying to get that blockage to open, and we want fluid to move. That's why towards the end of the lymphedema case I showed you, the last application, all it was a spiral. There were no crossing over pieces anymore. All I'm doing is creating a channel, right? So yes, direction is important. Yes, it creates a channel. Yes, it does decompress all of it. So important to think about that. Also, I want to point out in the lower extremities, so anything below hock or carpal knee, right? There is no muscle. There is no contraction happening. It is only blood vessels, tendons, ligaments, bones, cartilage. So when you get that fluid sitting there, that's one of the reasons why it does that, is because up in the body, at least we have muscles contracting and moving, and that also helps the lymph system move, right? Because the lymph system needs movement. So below those pieces, we have to create movement. We have to create movement. Stall rest is the worst for these type of animals. If you have anything lymphatic going on, them not moving is doing the opposite of what you need them to do. So I almost always get those animals out as quickly as possible. It does help astronomically. So of course, obviously you want to stay in communication with your vet or the vet on the case that you may be working on. But definitely we want to get these animals moving as quickly as possible.
Awesome, thank you. Any other questions from you guys? These cases are so interesting to discuss. They're so interesting to look at. If you want to look, another perspective, we're all about getting different perspectives. And we have had in the past a conversation on the lymphatic system with Krista Veinota, and I'll add that to our stream again and reshare that. But very interesting perspective on how the system works and how we can address it in different ways. So we were talking about more than just Kinesiotape and some of our other tools and modalities as rehab therapists that we might want to use and add to that. So that was a very interesting conversation as well. If you guys want to go back to that, you're very welcome to. Yeah, and I think that it is, as with so many things, the lymphatic system is an area that we forget about, that we neglect very often. And it is a system of the body. It is a part of the function of the body. And if we're not addressing all the systems of the body, and if we're not giving them what they need to correctly function and heal, we'll end up with problems there. So, Rebecca, thank you so much for sharing with us today, for chatting with us. We have someone say, so glad I had this pop up on my feed. We're really happy to have you. Thanks for joining us. Yeah.
I can tell you one of the things that I do now with pretty much every horse that I work on with any type of injury or swelling, I always now tag in the lymphatic system. I feel like they just heal faster. And so, I mean, I don't care if it's a tendon injury. I don't care if they have an abscess on their foot. You know, I am now tagging in the lymphatic system some way or another, and I am finding that I can keep that body really moving and healing quicker. So you'll start to see that some of these circulation applications, you might just have a, kind of a star going down it, if you will, those little fans just running down. And there's a reason for that. So I definitely, dig into lymphatics for sure. It's one of the modules I am currently in the process of building here at Equitape, and that'll be out. It takes me a couple months to build it and then a couple months to film them. So, but it is one that's in the works. And then I did just do a practical solutions on this to show you exactly how I put that application on. It's very simple and anybody can do it. When it comes to lymphedema, anybody can do it. I promise you, a horse owner can do it. The barn manager can do it. You're not going to hurt your horse. All you're going to do is help your horse. So this is one area you don't have to worry about it. Learn how to do it, and it should be a must. You can add in lots of different therapies. I always warn people, be careful about, too much of things, because a lot of modalities, too much can get to them. But one of the, I always add into extreme lymphatic cases is chiropractic. The more we can get things to move, the more fluid we can push. And we want to find that block and we want to unblock it. So the more fluid I get out of her leg, the more she gets chiropractic. So we can move it and we can help everything move. So definitely, this is just a tool in the toolbox. And we have to use the whole toolbox to help a horse all the ways. And so, I like to point that out as well.
So let's just repeat the contraindications first, and then also the concerns with the physiological response, what we need to keep our eye on so that our listeners are certain of what they need to do.
So for them. Sure. The 3 contraindications when using kinesiology tape, and this is on any animal, anywhere. Number 1, you do not want a systemic infection going. So if the animal has a fever or anything telling you that they may have an internal infection, you do not want to use kinesiology tape unless the animal has been on antibiotics at least 4 to 5 days. Okay. We never tape over an open wound. You always want a non-stick padding between the tape and the wound. And then anytime the skin itself has any fungus or bacteria on it, it's not going to spread the fungus or bacteria, but it will not stick and it will just waste your money. So don't even worry about it. Clear up the fungus and bacteria and then go ahead and tape. So those are the contraindications. If you are doing critical care, so that's that last case that I showed you, critical care, young horses, and you're going to activate the entire lymphatic system. You need to make sure that you are taking vitals. Again, I start every minute, go to 2 minutes, go to 5 minutes, and I do that for at least a 40-45 minute window. What you're looking for is you will see a spike in vitals, but as long as they're in the high normal range, it's okay. If they go over the high normal range, so it's important to know what breed you're talking about, because the high normal changes per breed, and you have to remember that. Whether you're talking about a Shetland pony or a warm blood, you're going to have different norms. So they can go all the way to the top of the high normal, but they can't go over. If they go over, you need to start pulling pieces of tape off until they regulate back down. You will see a spike, but they do generally come down, and normally it's within that 20 to 25 minute mark range. So if you are going to use it for critical care, please make sure you have a vet present or a vet nurse that can do vitals for you if you do not know how to do them yourself.
Perfect. Thank you so much, Rebecca. That was great. Guys, if you have any more questions, please post them and share them if you're watching this as a recording. We will come back and answer those questions again over the next few days. So there's no issue with doing that. Join the conversation. If there's something you're unsure about, ask. That's what we're here for. Rebecca, thank you so much for joining us again today. It's been great having you.
Oh, you're welcome, and thank you guys for having me again. I hope it helps. If you guys think of a question later on, you're welcome to email us at education@equitape.com as well, and we can give you whatever information you'd like to know about on some of these case studies that we showed today.
Awesome. Thanks so much. Bye, guys.